So just a quick overview of this session, some of the different topics that we'll be diving into. We'll start off with just a quick introduction to some of the basic concepts and methods around qualitative research. But we're going to focus the majority of the session on sort of the practical technical components. So we'll talk about creating qualitative guides, about sampling participants, and then also how to really host and facilitate focus groups and collect qualitative data. So the majority of this will focus primarily on focus groups, and that's because that's one of the methods that we see used very often throughout the types of public health research we do, and also because some of those principles are very applicable as well to in-depth interviews and some other qualitative methods. And hopefully we'll have time to get into qualitative transcription as well. If not, we will continue this session in another session and go over qualitative transcription as well. So we'll see what we're able to get through. Okay, so just some quick ideas if you can throw out in the chat, just for me to gain a little bit of an idea of who all is here today. So if you could answer whether or not you've conducted qualitative research before, if so, what sort of methods you used, and then also have you transcribed qualitative data before. So I'll give just a few moments if you want to put anything in the chat, and if this is all completely new, that is okay as well. Just an idea for us all to see where our experience is.
Okay, colleagues, you can use the chat box to post if you've done qualitative research before, you've ever interviewed participants as part of a qualitative study. Let us know your thoughts.
Okay. Okay, well, I'll keep that chat open and move forward in the meantime, but please feel free to share your experience. We can all learn from each other during this session, and everyone's experience is very valuable. So, oh, wonderful. Some focus groups, some key informant interviews. That's great to see. Okay. Okay, so we will start off just with a quick overview of some basic concepts and methods. So first, to just broadly define sort of the goal and aims of qualitative research. So I pulled this quote here that qualitative methods generally aim to understand the experiences and attitudes of patients, the community, or healthcare workers. These methods aim to answer questions about the what, how, or why of a phenomenon. So when we think about quantitative research, our goal is really to measure something, measure health outcomes, measure use of care, measure quality of care. We're really interested in being able to have some statistical measure and be able to perform analyses with that. On the other hand, with qualitative research, we're really interested in understanding and describing. So that's understanding different views, attitudes, behaviors, influences. The goal here is not to measure, but more so to really just understand and describe a particular situation. And wonderful. I'm just seeing all the answers in the chat. Thank you all for sharing your experience. It looks like we have some experience with transcribing data, focus group discussions. Wonderful. Great to hear. Thank you for sharing. Okay. So this diagram is just sort of a broad overview of different qualitative research methods. I'm going to quickly sort of describe a few of these ones, and a lot of these sort of work together as well. So, for example, phenomenology, that's really trying to gain an in-depth understanding of a specific phenomena. Often that will use one-on-one interviews or focus groups, but that's really trying to gain an in-depth understanding of a specific experience of interest. There's also grounded theory, which you'll hear about a lot, and grounded theory is really taking the approach of generating and creating theories based on data. So that differs from sort of typical research where we come in with a hypothesis and we're then testing that hypothesis. On the other hand, grounded theory takes a different approach. It starts with the data, the focus is on data collection and analysis, and then from that, generating hypotheses and theories. Ethnography is also another approach that you'll see, and sort of the key around ethnography is the idea of immersion. So the researcher will immerse themselves in the context they're interested in the culture they're interested in. This is used a lot in anthropological research. And we also see case studies as well. And that's when we're looking at a specific case of it could be an event, a group, an individual, and really doing an in-depth exploration and analysis of a particular case. But really what we're going to be focusing on today are these two on the right in orange, so one-on-one interviews and focus group discussions. And one-on-one interviews can take different approaches. There's semi-structured interviews where researchers come in with a guide and they use it sort of to their discretion, but also are able to follow the conversation naturally and come up with additional questions and probes as they speak to the participant. There's in-depth interviews, which is really diving into particular participant experiences and trying to gain a full understanding, and also the idea of life histories as well. So really understanding that individual and their lived experiences. And before we dive in, I just wanted to give a brief overview of some of the strengths and limitations of qualitative research. It's important in any type of research we're doing to understand what are the strengths and where are we limited. So some of the strengths for qualitative research, it allows you to provide contextual relevance that sometimes we lose in quantitative research. It allows for really in-depth insights of understanding participants, understanding the context that we're working in, allows for a more holistic perspective to really describe what is going on, as well as recognition of participant voice. And that is something that I enjoy the most about qualitative research, is the opportunity to really amplify voices of participants, whether that's through using quotes when we come to the reporting stage, but really allowing participants' voices to be heard. And that's really a main strength of qualitative research. And qualitative research also allows for reflexivity and flexibility. So reflexivity is the idea of the researcher being aware of their own thoughts and opinions and how that influences the research process. So it's really understanding that when you're undertaking qualitative research as a researcher, understanding your subjectivity and how that may influence the research process. And that's something that can really be explored and reported in qualitative research, understanding your own thoughts and takeaways. And then flexibility as well. With qualitative research, often we have a guide, and we'll talk about that. But often it's when we're speaking with participants, we're flexible and able to ask new questions. If the participant mentions something that's really interesting to us, we can deviate from that guide. And that's a little bit opposed to quantitative research, where we're following a very structured questionnaire or survey. So qualitative research has a lot of strengths. There are also some limitations that are important to discuss as well. It is susceptible to research bias since it's a bit more subjective than quantitative research, which aims to be very objective. There is limited generalizability. So in qualitative research, we often have much smaller sample sizes than quantitative research. So that limits the ability to generalize our findings to an entire population. It's resource intensive. It can be very time consuming to conduct focus groups and interviews. Often those can last an hour and a half. So it is very resource intensive. It can be complex research design, and it also requires the researcher to have the knowledge and skill to navigate conducting qualitative research. So just a few strengths and limitations to think about as we sort of dive into how to conduct qualitative research. And just a quick note as well on ethical considerations for qualitative research. So just to highlight that the same guidelines apply as to any human subjects research. So as always, you need to seek IRB approval, so have ethical review and clearance, and it's really important to remember the ideas of consent and confidentiality. So informed consent, just as it applies to quantitative research and medical research, also applies to qualitative research. The idea of informing patients of the goal of research, use of their data, what participation could entail, potential risks. So still need to obtain informed consent and ensure that participants are well aware of the research and are able to ask questions and make an informed decision, as well as confidentiality. So still incredibly important to protect patients' privacies, to protect sensitive information, and follow all guidelines and IRB protocols as well. Okay, so as I mentioned, we'll primarily focus today on focus groups, but a lot of the focus group discussion sort of guides and principles also apply to one-on-one interviews as well. So just to start, so here's a definition of a focus group. It sounds like some of us are familiar with this approach, but just to specify, so a focus group is a research method that brings together a small group of people to answer questions in a moderated setting. So the group is chosen due to predefined demographic traits, and the questions are designed to shed light on a topic of interest. So sort of the two takeaways from this definition are the idea of choosing participants by predefined demographic traits and questions being designed to shed light on a specific topic. So we're going to talk about both of those in much more detail throughout this session, but just two different characteristics to keep in mind. And then I've also just jotted down a few key characteristics of focus groups here. Again, we'll discuss these more throughout the training. But a few key characteristics is, again, we mentioned participants being selected based on certain criteria, an interest in understanding a broad array of views and perspectives, guided by open-ended questions, and we'll walk through sort of how to come up with questions and some examples of focus group questions. It takes place at a pre-scheduled time in a specific location, and usually you want to focus on a very accessible community location. We'll talk about that as well. Often audio recorded and then transcribed at a later point, and often involves both a facilitator or moderator as well as an assistant. And we'll talk through all of this, but just to give a broad sort of picture and bear us to what a focus group is. Okay, so before we get into the details of each of these, here's just a broad overview of the general steps in conducting focus groups. And during this training and subsequent trainings, we'll go through each of these steps in more detail, but this is helpful to sort of get a picture of what the process will look like. So obviously start by choosing your research topic, defining the scope and hypotheses of your research. This will also involve creating your research questions and aims. Then it'll involve determining your focus group questions, creating your guide, selecting a moderator and assistants, having your research team. Next will be recruiting participants, setting up the focus group, hosting the focus group, and then data analysis and reporting at the end. So to start, we'll start at the beginning of this process, thinking about research topics and defining the research scope and hypotheses. So here are just some examples of research questions that can be answered through focus groups and other qualitative methods. So for example, we can think about exploring how a community perceives a given public health problem, a policy, a program, etc. What are a group's experiences with a particular phenomenon? That could be a particular health behavior, a particular illness, a particular disease. What beliefs does a community have about a given issue? You can think about health behaviors as well. For example, exploring infant feeding practices, exploring views around vaccination. And here are some additional examples of topics. So experiences of health issues, experiences accessing and receiving care, exploring different views and opinions. For example, looking at views of healthcare providers or looking at views of patients. And then understanding how lived experiences and other factors influence health beliefs, practices, and outcomes. So really sort of the takeaway from this slide is thinking about the verbs here. So perceive, what are groups' experiences, beliefs, views, opinions. Just as we introduced at the beginning of the presentation, with qualitative research, we're seeking to understand and describe different phenomena. So I just wanted to give a couple examples of particular aims. So this is one project that I worked on a few years back with colleagues at the University of North Carolina at Chapel Hill, as well as at the University of Nairobi. And this was looking at fathers and grandmothers' experiences participating in nutrition peer dialogue groups. So there was this intervention, and these nutrition peer dialogue groups were aiming to improve maternal and child nutrition outcomes by engaging fathers and grandmothers in understanding nutrition and feeding practices. And here I just highlighted the aim of our qualitative research. So here we conducted focus groups to explore views. And you can see here the aim was to explore grandmother and father experiences participating in interventions and how participation influences care and feeding practices. So we were really interested in exploring experiences of our participants. And not measuring anything, but just exploring and describing their lived experience. And here's another example of another project. This project was looking at exclusive breastfeeding practices among women working in the informal sector, and this was in Moshi, Tanzania. So whereas the previous study was using focus groups, this was using in-depth one-on-one interviews with participants. And I've just highlighted the objective of our research aim here. So the objective of this research objectives were to examine barriers and facilitators to exclusive breastfeeding among women working in the informal sector and identify the strategies women use to meet infant care and feeding and informal work responsibilities. So this was really aimed at understanding the lived experiences, understanding barriers and facilitators and strategies that women use to feed their children while working in the informal sector. So just a few ideas of what this really looks like in practice. But I would encourage you throughout this presentation to think about the work that you do and what sort of qualitative research aims and questions might be applicable to your work or work that you're interested in doing. Okay, so the next step is to determine our focus group questions. And this leads us into the second part on creating qualitative guides and then going into choosing our participants. So just to introduce this, so what is a qualitative guide and when do we need it? So a qualitative guide is a series of prepared open-ended questions to help you explore your research aims and keep the conversation relevant. So it often will include sort of key questions, your key research questions, and additional probes. And I'll talk more about probing and how to probe in a few slides. But a key note to think about here is a qualitative guide is a guide. So if we think about quantitative research with questionnaires and surveys, often it's very structured. There's a very specific sequence of how we're supposed to ask each question, how we should move through the survey. Whereas with qualitative research, it's much more flexible. The guide is there to help you explore your research questions, but it really takes a skillful facilitator to really navigate the conversation and maintain a natural flow. So often The guide, you can start off by asking some of the questions, and then your participant may say something really interesting that you want to explore further that's relevant to the research. And it's okay to ask additional questions to veer off from the guide a bit, and if needed, resort back to the guide to continue the conversation. So just thinking about, we talked about the strengths and limitations of qualitative research, and one of the strengths was flexibility. And this comes into play with that flexibility, thinking about being guided by the guide, but not necessarily bound by it. So qualitative guides are helpful for structured and semi-structured interviews, as well as focus group discussions. So that's the context that they're helpful for. Okay. So here are just some general ideas of the types of questions that you may think about when building a guide. So there's different categories here. This is really just helpful in starting to brainstorm and thinking about when you're writing up your qualitative guide, what types of questions are helpful. So often there'll be one or a few opening questions, and this is really focusing on usually just encouraging participants to introduce themselves. So for example, if you're in a focus group, and we'll talk a little bit about what that will look like later on, but often at the beginning, there might be sort of an icebreaker and allow the participants to go around and introduce themselves so that everyone knows everyone. And it's a little bit more of a warm and welcoming environment with a little bit of familiarity. So often we'll start with those opening questions, and then you'll have some introductory questions. So this will involve sort of easing into the research topic. This can be sort of broadly asking a general question about your research area of interest. And we'll talk about this more as well, but sort of the idea of starting more general and then going into more specific questions. So if you want to ask about, for example, say we're interested in infant feeding practices, specifically the idea of exclusive breastfeeding, we may start more broad, asking about practices feeding children in the household before diving straight into questions around exclusive breastfeeding. There is also the idea of transition questions, and these are sort of questions that help you guide to the conversation, moving from one topic to the next, and sort of helping you to navigate through the discussion. And then the focus is really on what we call our key questions. So these are the main questions related to your research objectives. And everything else is sort of built around your key questions. And these are the questions that are going to help you answer your research question and really glean some informative data. And then at the end, there'll also be some closing questions. So often a practice is to ask participants if there are any other topics, areas that were not covered that should be discussed. So you go through your questions, you have a great conversation, and then opening the floor and asking participants, are there topics that we haven't discussed that are relevant? Are there additional questions that we should be asking and should be talking about? And that's really to give the participants some agency and voice as well in ensuring that their views and perspectives are communicated and are recorded in the data. You can also often ask participants to reflect on the conversation and mention any sort of key takeaways. So you can allow a few minutes at the end to have everyone think back over the past hour of the conversation and what is your takeaway from what we've discussed today? And that's often a very helpful way to make sure that you're accurately representing participants' views and the data. And then another practice as well is to, at the end, present sort of a brief summary of the conversation and ask participants if the summary adequately captures what was discussed. So once you've given participants an opportunity to bring forth any additional topics, you've had participants to bring forth their key ideas and takeaways from the conversation, you can then offer your own sort of summary of what was discussed, talk about your takeaways, the key things that you gleaned from the conversation, and ask, does this adequately capture what we've discussed? And we'll talk a little bit more about how to do this as well. But this is just a general idea of types of questions that are helpful when building out your guide. Okay. So now we'll talk through some general tips for creating useful questions. So this is going into more specifics. If you want to come up with specific questions, just some general sort of tips and tricks that are often used. So one tip, there's a typo here, my apologies. This should say use simple language. So it's important to try to avoid complex terms and jargon as much as possible. In research, we often have very technical words that we use, jargon, technical definitions for things, and that's great for us as researchers, but it's really important when conducting qualitative research to simplify things and try to use very simple language and avoid some of the terms and jargon that might not be familiar to everyone. So to really focus on sort of everyday conversational language. One type of question strategy that is often used that is helpful is what we call think back questions. So this is useful if you are trying to have participants recall a specific time in their life, a specific event that they experienced. And this will start with think back to a time when. And this other tip sort of goes hand in hand with that of using concrete examples and events. So it's helpful to try to identify a specific event or time period when using these think back questions. So for example, rather than asking, think back to what you fed your child as an infant. If the participant has multiple children, this can be a difficult question to answer. It's often helpful to sort of pinpoint a specific example. So think back to when your youngest child was born and sort of bring the participant to a specific reference and experience in their life. And that just helps to get the thoughts going to help orient the participant to think back to a specific experience and have a more fruitful conversation. So this is sort of similar to the idea of recall periods in quantitative research, where we think back to a specific time period. We can use similar strategies with qualitative research. So giving a specific event, or we can even give a specific time period as well. Okay. And a few more general tips. One that's really important is the idea of open-ended questions. So this is really sort of at the crux of developing qualitative research questions, is the idea of avoiding sort of close-ended yes, no, one-word questions and trying to keep them open and broad to facilitate discussion. So often it's examples are like, what do you think of, or how do you feel about, rather than yes, no questions. And I would say this is a great starting place when you start brainstorming ideas, really focusing on what are the questions that are going to facilitate discussion that can't really be answered just in a simple yes, no, or a simple one-word question, one-word answer. And, sometimes participants will answer in one word, and that's okay. But just a general tip for developing research questions. Another tip that I mentioned earlier is the idea of going from general to more specific throughout the conversation. So to start off the focus group, it's helpful to sort of ease into the research topic. Participants are still getting to know each other. They might feel a little bit nervous or shy. And starting off with more general, sort of easy questions to answer is really helpful for sort of getting the natural flow of the conversation going, and then moving into more of the specific research questions. We also want to be thoughtful with sensitive questions. So if there are questions on your research topic of interest that might be sensitive to talk about, sort of best practice is to try to keep these more towards the end of the conversation. You don't want to start off with some of the most sensitive questions, that might make participants uncomfortable and uneasy throughout the conversation. Really, you want participants to feel as comfortable and welcomed as possible. So just to be mindful of that and thoughtful for how you approach those types of questions. And then another key point, and I'm going to talk more about this and give some examples, is to avoid leading questions. So these are questions that could imply there's potentially a right question, a right answer, or a wrong answer, or suggest a certain response. We want our questions to be as neutral as possible. Really important to be non-judgmental and not imply that the participant should answer a certain way. And I'm going to give an example here. So as I mentioned, we want our questions to be as neutral and unbiased as possible. And this is because in qualitative research, just as in quantitative research, there's this concern of social desirability bias. So this is when participants may feel that they should respond or need to respond in a certain way that could be, a more socially desirable response. So this is a concern just as much in qualitative research. So one way that we can try to mitigate this concern is by really focusing on how we phrase our research questions. So I have an example here. So the first question is, why have you not vaccinated your children? So say, for example, you're conducting an in-depth interview with a mother and are exploring health practices, health behaviors, and the mother mentions that the children have not been vaccinated, did not receive their vaccines. So your follow-up question might be, why have you not vaccinated your children? But the concern with this phrasing is that it might come across judgmental. It might come across as though implying, oh, the mother should have and she didn't. It's a bit of a leading question that might result in some social desirability bias. So perhaps a better way to word this question would be the second part, which is, what influenced your decision on whether or not to vaccinate your children? So here it's a much more of a neutral tone. We're not implying one way or the other. We're just asking in general, what influenced your decision on whether to vaccinate your children or whether not to? And this isn't really inferring a right or wrong response. So that's one example to think about. Okay, another facet to think about is the idea of using personal versus hypothetical questions. So in focus groups, so to keep in mind, there are multiple participants there. Many participants may not know each other. This might be the first time that they're meeting. And some participants may be shy or uncomfortable answering specific questions, specifically about themselves. And this, again, can also tie into the idea of some of those sensitive topics or more sensitive research areas. So one way that we can help address this is to reword questions from asking about the participant themselves to asking more generally about the community. So for example, one way to do this would be, say our original question is, has your family ever gone into debt in order to feed your children? So that's asking specifically about the participants. And some participants might not feel comfortable answering that. So one way we can reword that to generate more discussion, to make participants feel more at ease, is to make it more general. So do families in the community ever go into debt to feed their children? Another example of this, so say our original question was, who decides in your home how money is spent? Do you get to decide? Again, that's asking specifically about the participant themselves. One way to potentially rephrase that could be, do women in the community get to decide how money is spent? So this is a practice that I've used specifically in creating focus group guides before. My team and I were working through creating one, and we noticed all of our questions were asking specifically about the experiences of the participant themselves. But these were going to be in focus groups where participants didn't know each other. And we decided it might be better if we make the questions more general, asking hypothetically about women in the community or families in the community, and able to generate more conversation and discussion from that. Okay, so we're going to do a quick practice here. So I have two scenarios that we can walk through. So, scenario one, you are conducting an in-depth interview with a mother in Akobo, South Sudan, exploring her beliefs and experiences with pregnancy. So, our original question is, why did you not attend antenatal care services when you were pregnant? So, say we're in the middle of our interview. We've been talking about experiences with pregnancy, health practices, and the mother just mentioned that she did not receive ANC services. So we want to follow up and explore that. So our original question was, why did you not attend antenatal care services when you were pregnant? So I'm going to ask you to try to rephrase this question to a more neutral tone, thinking about what we just talked about as far as rephrasing and asking in a little bit more of a less leading way. So I'll if you have any ideas, feel free to put them in the chat. May also come off mute if you would like to, but I'll allow a minute or so for this.
Okay, we can give an opportunity, colleagues. If you want to rephrase this to your fellow colleagues, you can put up your hand and okay, looks like colleagues are still internalizing the question. Hopefully they would come with suggestions. Anyone who
Okay.
want to take on this?
Yes.
Yes, so Widow Joseph, please go ahead.
Yes. Yeah, thank you. Yeah, for the questions, like to rephrase it again, I think from my side, I may decide to put it like this, that were you able to attend antenatal care service during your pregnancy?
Mm. Yes, yeah. That's one way to rephrase it, definitely. So asking in general, were you able to? That's important thinking about access to care. That's one way. And I'm seeing
Yes.
some other examples in the chat as well. So, why do women in your community not attend? Are there any factors that hindered you from attending? That's also a great question. So, thinking about specific factors that could affect access. Great. Another one, what influenced your decision not to go for antenatal care during pregnancy? Fantastic. Yes, that's a great example. So thinking more broadly, more generally, what influenced your decision? So not implying why did you not sounding leading in a certain way, but just asking in general, what influenced your decision? Great responses. Great job. So this was one example that I came up with, very similar to the examples you all shared. What influenced your decision of whether or not to attend antenatal care services? So great job. Okay, so scenario number two. So this is similar, but a little bit different now. So now you're conducting a focus group with 8 mothers of children under 2 in Akobo, South Sudan. And again, we're still interested in exploring health-related beliefs and practices surrounding pregnancy. So now we're thinking about in the context of a focus group, there's multiple participants. And here's our original question. We originally want to ask, what health challenges or concerns did you face during your last pregnancy? So thinking about the fact that now we're in a group setting, how might we rephrase this question to be cognizant of answering these specific questions? So I'll give you a few moments as well to think about this one.
Okay, I'm seeing thoughts from Hassan. What hindered you from attending antenatal care during the period of your pregnant, the period during the period you're pregnant? And Joseph has also put in another version here. Were you able to visit antenatal care services during your pregnancy?
Yeah, great options. Okay. Okay, here's another example. So what are the most common challenges to women in your community face during pregnancies? Fantastic. Yes, that's a great rephrasing of this question. So the reason this question might be a little bit difficult to answer in a focus group setting is it's a personal question. You're asking specifically about, what health challenges did you face? And that might be a hard question to answer in the context of a group, people you don't know. So asking in general about women in the community is a great way to still glean some information and still have a great discussion while making sure that participants feel a bit more comfortable. I'm seeing some more examples here. Can you describe any health experiences, concerns? Did you encounter? Yeah, great job. Okay, so here are some examples I came up with. What types of health challenges and concerns do women in the community face during pregnancy? Or what are commonly faced health concerns during pregnancy in the community? And again, what health concerns do women in the community worry about during pregnancy? So similar to some of the options that you all came up with. So yeah, wonderful to think about. And good job with those practice questions. Okay. So now we're going to move on a little bit to the idea of probing. So now we've followed these previous guidelines to come up with some of our key research questions, the key questions we want to ask during our focus group. And a very important skill in qualitative research is the idea of probing. And I think this is something that just takes some practice, and there's a lot of flexibility with this as well. But the purpose of probing is really to clarify, to gain additional details, and to enhance the depth of responses. And it's a very important, critical part of conducting qualitative research. So it's helpful to try to prepare some probes ahead of time in your qualitative guide. But you also may come up with additional probes naturally during your conversation. So just as we spoke earlier about how our guide is really just a guide. We're not bound by it. We're allowed to deviate from it and follow the course of the conversation. The same idea is with probes. I think it's helpful to think of some probes ahead of time so that you have that guide to look to, but also probes will come up naturally just during the conversation as well. But a few guidelines around probes. Often they're very sort of short, simple follow-up questions. Again, clarifying questions that help us to gain more details on a response. And it's also important to sort of vary the probes that you use and the frequency of use. This is sort of meaning that you don't want to keep asking the same follow-up question to every response, but just keep it natural. And try to have a natural conversation. And probes can also be nonverbal cues. For example, pausing, allowing participants to think for a moment and then continue. Leaning forward, looking engaged. Those can all sort of help probe additional responses. But it's important that those nonverbal cues are neutral. And I'll talk a little bit more about that later as far as sort of as the moderator, as the facilitator, maintaining a neutral tone throughout the conversation. Okay, so there are multiple sort of probe frameworks that exist in the literature. And one framework that I'll introduce is called the DICE approach. And I'll just say that these frameworks are really just to help generate some ideas and brainstorm some probes. There's no one sort of correct way to go about this, but I think some of these frameworks are just a little bit helpful in getting us to think about what we might be interested in asking, thinking about how to create our guide. So this one approach called the DICE approach. And so D stands for descriptive probe, I, ideographic memory, C, clarifying probe, and E, explanatory probe. And this is just easy, helpful for us to remember when we're at the point of creating our guides and thinking about what sort of probes we might want to include. So I'll go through each of these for us. Okay. So for D, we have descriptive probe. And the purpose of these types of probes are just to gain more details, to contextualize, and you can address both sort of the external environment as well as think about internal feelings, thoughts, emotions of the participant. So this is a very broad category of probes. But just thinking about the idea of being a descriptive probe, you're trying to gain further details into a participant response. So say, for example, you're speaking with a participant and they mentioned a time that they were recently in the hospital and they're talking about the quality of care they received. And then they start talking about something else. Say, for example, you want to learn more about their experience in the hospital. A follow-up question, so our follow-up probe could be, tell me more about what happened when you were in the hospital experiencing XYZ. Or for example, say a participant is talking about the quality of care they received at the hospital. They're talking about their interactions with the provider and the care they did or didn't receive. And you want to know more about what that was really like for the participant. You could follow up with, for example, can you describe how that experience made you feel? So these probes are really just trying to get more details and very, very broad. Another type of probe, for the I in DICE, is the idea of an idiopathic memory probe. And this is sort of what we talked about earlier as far as the think back questions and offering a specific time point or a specific event. So these types of probes are focusing on memories from a specific time period as opposed to more general memories. So for example, I have one here. You mentioned that sometimes your family will go without food for a day. Can you describe a time when this happened? So that's pointing to a specific event and asking that participant to explain that a bit more, talk about that a bit more. Another example could be, you mentioned that you changed your diet when pregnant. Can you talk me through what you changed in your diet during your most recent pregnancy? So again, this is trying to just bring the participant to a specific event, a specific time period in their life, and that helps to come up with more specifics. I think just in general for us, it's helpful to recall a specific period and then rather than in general speak about experiences. And you'll also notice a lot of these categories of probes, they're not exclusive. So a descriptive probe, an idiopathic memory probe, they can be intertwined. You can have components of both. This framework is really just to help us brainstorm the types of questions we might ask. All right, and then the last two letters. So for C, we have clarifying probes. And this is exactly what it sounds like. So this is just to try to gain clarity on how participants understand and make meaning of different concepts. So for example, questions, clarifying probes could look like, can you describe what you meant by X? Could you clarify what you meant? You mentioned you give your children nutritious foods. What does nutritious food mean to you? So this is really just trying to understand a bit more, clarify what a participant means when they use that phrase, use that word, and understand how they view and make meaning of these different topics. And then last, we have an explanatory probe. So these types of probes try to gain understanding of perceived explanations for a given event or outcome. So for example, one question we have here is, why do you think that happened? So say, for example, you're speaking to a participant and trying to come up with an example. Say they were at the hospital, they were trying to receive care, and they had a very long waiting period. Weren't able to see a provider immediately. You can ask, why do you think that happened? And follow up with additional explanations and trying to understand what does the participant think is the reason that something happened. You can also ask, for example, what do you think are the reasons you felt that way? So it can point to, specific external events, but also to emotions and beliefs and attitudes of, really exploring those why questions. So again, this is just a framework for helping to generate some ideas. And these are not rules, but just helpful for brainstorming types of probes to help have a very rich and meaningful conversation. Okay, so we're going to do another practice here. So we're going to work on our probes here. So the scenario is you have developed the following qualitative guide for an interview with a mother. You're interested in exploring access to markets and food choices. So our three sort of main questions are, number one, where do you go to purchase food for your household? Number two, what foods do you typically buy? And number three, do different members of the household eat different types of foods? So thinking about food distribution and feeding practices within the household. So those are our sort of three key research questions. But now we want to come up with some probes to have a more meaningful discussion, to gain clarity on some of the answers, to further explore and understand participant responses. So I'll give you a few moments. You can either just pick one of these questions, one, two, or three, or if you want, you can try come up with probes for all three of them. Again, there is no right or wrong answer. There's no correct answer. It's just helpful to think about brainstorming and what types of follow-up questions and probes could be helpful for us for understanding these questions. So I'll pause for a moment there. Feel free to put in the chat. Also feel free to come off mute and speak as well. Okay, I'm seeing some great ideas in the chat. One would be, how do you have accessibility to the market in your area? How far is the market point from your home? Yep, those are both great questions. Thinking about access, thinking about transportation, trying to better understand participants' lived experiences as far as how are they able to access food markets. Here's a probe for question number three. Understand the different foods eaten by children, women, and elderly. Yep, that's great. So say, for example, the participants respond saying that food is distributed differently within the household, that the women eat something different than the children. A great follow-up question would be to explore that and try to understand what are those different foods that different people in the household are consuming. Another question, why do you think your family always buys from a particular market? Yeah, that's a great question. Thinking about choices and different market access choices, thinking about what options do participants have, and if they always go to one particular market, exploring why that is. That's a great follow-up question as well. Great. These are all really great ideas. And feel free to keep thinking about these. I'll give a few examples that I was thinking about as well. So for the first one, where do you go to purchase food for your household? A potential probe could be, are there other places where you could purchase food? So that comes to the example in the chat about, why do you always buy from a particular market? We could ask about, are there other options? Why do you go there? Think back to the last time you went to buy food. How did you get there? Who came with you? So this is using that think back strategy and pulling them back to a specific time. So not just think back to in general when you buy food. This is saying the last time that you went out and bought food for your household. Think to that specific time. What did that look like? How did you get there? Who came with you? So orienting participants to a specific time. I'm seeing some more ideas in the chat. Do you have access to the market in this area where you can buy food for your family? Very important question. Really important to think about market access. How often do your family members change diets? Also a great question for their healthy body and growth. Yeah, great question as well. Thinking about what household food distribution might look like, the reasons for that. So for question 2, what foods do you typically buy? Other probes could be, why do you buy that food? You could go, if they list out 5 different foods that they typically buy, you could ask about each of those. You could ask about one of those. How do you decide what to buy? Thinking about the factors. Is it cost? Is it thinking about nutritious foods? Is it preference? Is it all of the above? So understanding those choices as well. And then here we have another example of a think back question. So again, think back to the last time you purchased food for your household. What did you buy? And that can be helpful in just sort of jogging the memory of participants. I think sometimes it can be difficult to answer just in general, what food do you typically eat, but orienting you to a specific time point helps to come up with those ideas. And then for question 3, do different members of the households eat different types of foods? A potential probe could be, if yes, who eats what? Why do you think that is? What are the reasons why different members eat different foods? So again, just trying to clarify, trying to gain more details, and trying to have a more in-depth understanding. And this will really allow us to collect some very rich data and be able to analyze and report really interesting data later on. A couple more ideas in the chat in relation to inflation. How does the current price of goods in the market compare to the previous 2 to 3 months? That's a great question. Yeah, wonderful question. Thinking about, and that's also sort of tying in different time points, thinking back 2 to 3 months versus now. So great types of questions. Wonderful. Okay, and this is the last point on coming up with qualitative guides. Now that we've talked through types of questions, general approaches, probing, it's just the idea of refining the qualitative guide. So I think it's really important to seek feedback from your research team, from colleagues, and also from individuals in the community that you are planning to conduct your qualitative research in. So to think about, are questions being understood the way you are intending them? Are the questions suggestive of a certain answer? Thinking about ensuring we have very neutral questions like we practiced earlier, but often it's helpful to have another set of eyes looking at the questions and hearing their feedback on whether our questions have a neutral tone. Are questions appropriate to the context you're working in? So ensuring that you're familiar with the context. Is there a more useful way to reword some of the questions? For example, if questions aren't being received the way that you're intending them to, asking for feedback on how could we reword this? What could make this more simple and clear, easy to understand? And then, is the guide missing any key questions or useful probes? So just as we all came up with different ideas of probes, different ideas of questions, all great ideas, it's helpful to sort of work as a team, get feedback, and really refine the qualitative guide. So that's a great practice as well. Okay. So that was on determining our focus group questions. We're now going to move quickly to recruiting participants and then to setting up and hosting our focus groups. I'm going to try and move a little bit quickly because I know we're approaching time. So I'll go ahead and move forward with this.
Okay, Samantha, can we give an opportunity for, say, like 5 questions? I've seen some questions in the chat box. If we could take 5 and then we can defer the other ones towards the end, that would be great.
Sure. Sure, absolutely.
Yeah, so the first question is from Chaplin, and he's asking what strategies or best practices can researchers employ to minimize biases during the data collection phase. And the
Mm-hmm.
second question is around what are the most common critical ethical issues during research and survey. Number three, what are the main approaches to coding qualitative data and how do I choose between them? Maybe that may be for next session. Would you want to take on the first two around best practices to minimize bias and then critical
Mm-hmm.
ethical issues during research?
Mm-hmm. Sure, sure. Yeah, wonderful questions. Really great things to be thinking about. So the question around, I'm just looking in the chat, around minimizing biases. I think that's perhaps referring to the researcher bias, I think, or it could be referring to the social desirability bias as well. So thinking about researcher bias and how we all come in with our own views and thoughts and feelings and perceptions, and that is part of qualitative research. Is there is a level of subjectivity to it. But I think it's really important to disclose that in reporting. Often you'll see with qualitative research, sort of a best practice in the reporting phase is to disclose the background of the interviewers and the facilitators themselves. So there are guidelines around this. I'll put in the chat the name of a reporting checklist that is required by many journals, and it's also just a great practice. It's called the CORE-Q or COREC checklist, and that checklist requires researchers to disclose the factors and facilitate factors about the focus group researchers themselves. So their background, their relationship to participants, whether or not they know participants, what the participants knew about the researcher at the beginning of the study, information like that. And I think having that transparency is really important in sort of addressing any of those biases and just disclosing the state of the researcher to the participant. So I would definitely suggest looking up that checklist as sort of a best practice. And just that comes in a lot at sort of the reporting stage. And then I think about addressing sort of the idea of social desirability bias. I think really focusing, like we practiced, on the neutral questions, open-ended questions is really important, and also really trying to facilitate a warm and welcoming environment where the participants feel comfortable. They feel comfortable to answer as they normally would. And I'll talk a little bit about that when we get into the hosting and facilitating focus groups, sort of what the best practices are to try and make a warm and welcoming environment. So I hope those are helpful for answering that question. And the second question, if you could remind me, the second question was.
Yes, thank you very much for answering that, Samantha. The second question is around the most critical ethical issues during research.
Mm-hmm.
And
Yeah,
maybe
yeah.
in this context, we're referring to qualitative research.
Yeah, that's a great question. And yeah, there could be a whole presentation on thinking around ethical issues and factors during research and during qualitative research. And I would say it's really important in qualitative research, again, to remember consent and confidentiality. So at the start, before conducting any qualitative research, it's required to have informed consent from all participants. So usually there's an informed consent form where you'll describe the research to participants, describe the goals of the research, what the topics are, how data could be used, how data will be used, and what risks there are to participants. So that's really important that participants are fully aware of the research, aware of what is being asked of their participation, aware of how their responses will be used. and that participants are able to make that informed decision on their own. So there's a lot of, I think it would actually be great to even have a whole session on thinking about ethical issues and concerns during research, because there's a lot there. And then
Okay,
confidentiality
thank you.
as well.
Thank you, Samantha. Colleagues, be on the lookout for our future session on ethical conduct of research. That's a huge area right there. So, Samantha, you
Yeah,
could proceed to the next subtopic. Thank you.
sure. All right. Yeah. Thank you for these questions. Great questions. Okay, so now we're moving to thinking about recruiting participants for qualitative research. So how this differs from quantitative research. So often in quantitative research, we'll often want sort of a random sample of participants that's generally representative of the population at large. So in quantitative research, we're trying to take a sample of participants and infer about an entire population. And there we're concerned with issues of statistical power and representativeness. Qualitative research is very different when it comes to this. With qualitative research, we often take a more purposive approach where we're selecting participants of interest sort of based on certain characteristics or experiences. However, when we're doing that, we often still do want variation within that specific group of interest, and I'll explain a little bit what I mean by that. But really, sort of the key takeaway should be that your research aims should inform who you sample, who you recruit. You want to think about who it would be helpful to speak to in order to answer your specific research questions. So that might be mothers, it might be fathers, it might be physicians, it might be community leaders. It could be a mix of different people that you're interested in speaking with. There's often much smaller sample sizes than quantitative research. I mentioned that earlier. And also thinking about generalizability to the population at large is not a goal of qualitative research. Rather, as we talked about, we're interested in exploring participants' experiences. So one approach, and this is just one method, is thinking about maximum variation sampling. So in this approach, the research team chooses a few key participant characteristics that may affect their views, beliefs, perceptions, experiences, etc., of a given topic. So after you select whatever sort of key variables you think are of interest, you then seek to select participants representing different categories and combinations of those characteristics. So within those defined characteristics, you want lots of variation. So thinking about maximum variation sampling. So I'm just going to walk through this example for the sake of time. But one example of this would be, say, for example, you are conducting a series of interviews to explore infant feeding practices of working women. You want to take a maximum variation approach. So your next step is to think through what women you might want to recruit to participate in these interviews. So what are some of the characteristics that you might be interested in when defining your maximum variation sample? So this is thinking about, what characteristics could influence women's infant feeding practices, of these women who are working in formal and informal sectors. So some characteristics we could think about could be characteristics around occupation. So thinking about job sector, formal versus informal, full-time work versus part-time work. We could think about location, having some women from urban areas, some women from rural areas. Could think about having different women of different education status. And then we could also think about household and family characteristics. So this is often a time to sort of work with your research team, come up with what a few characteristics of interest, and then within those, try to have representation of those different categories. So that's one example. Here are a few other common sampling approaches. Just quickly, I'll run through these. One approach is called deviant case sampling. So this is purposefully choosing individuals who are of cases that are a bit unusual, a little bit outside the norm. There's also snowball sampling, which you choose a few participants to start with, and then at the end of each data collection period with those participants, you ask them, who else should we speak with? And they give you ideas of who else to then go out and sample. Convenient sampling, often used, is who's easiest to speak to, who's available and convenient. There could be criterion sampling, which is you have a specific criteria of interest and you're only interested in sampling participants who meet that criteria. And then there's also stratified sampling. So that's recruiting essentially subgroups of interest. Say, for example, you're interested in healthcare workers, you could recruit some physicians, some nurses, some pharmacists, different subgroups within that larger category. And then just a quick note on sample size. So there are no formulas for sample size for qualitative research. Rather, qualitative research is often informed by thinking about feasibility. So it's very time intensive, can be costly. And one approach is to think about the idea of saturation. So saturation is thinking about sort of how many people you need until you're not really gaining any new perspectives or new ideas. And often it's a bit of an iterative approach throughout the research process. A general rule of thumb for focus groups is you ideally want around 6 to 8 people per focus group, but sort of the number of focus groups you host can be influenced by different considerations. Okay, and this is moving to the last section here about setting up our focus groups and hosting them. Okay. So with setting up our focus group, we want to think about the environment that the focus group would be hosted in. So the location, time, and date should be chosen and scheduled ahead of time. You want a place that's easily accessible in the community, provides adequate privacy. And often it's helpful to have participants seated sort of in a circle, in a semicircle, to allow for better discussion. Often it'll be recorded. You'll have an audio recording device or two. And trying to have a relaxed, comfortable, low-stress environment. And often some light refreshments will be provided, perhaps some tea or coffee. So we also have our participants. I mentioned ideally 6 to 8 participants is sort of the ideal. And then you have your moderator and facilitator as well, which we've talked about. I'm going to skip this. This is what we've just mentioned about the different people. Okay, and this is a helpful slide thinking about the practices of a skillful facilitator. So whoever's conducting the focus groups, you want them to be knowledgeable about the research topic, have some insight into what the research aims are, what's trying to be explored. That'll help them come up with additional probes throughout the conversation. Often we'll share some similarities with the participants so that participants are perhaps more comfortable discussing and answering. We'll give an appropriate introduction at the beginning of the focus group. And I think an important note to identify here is the idea of being an active listener. So throughout the focus group, really showing that you're listening to participants, whether it's nodding your head, eye contact, being expressive. But as I mentioned earlier, it's really important to have neutral reactions. So not, having a facial expression that might infer, an adverse reaction to a participant's response, but really maintaining neutrality and encouraging and having a welcoming environment. It's also helpful for facilitators to use pauses and probes. We've talked about that. Ensure the conversation's being recorded. And then there's also this idea of sort of a 3-step conclusion at the end of the focus. And throughout, it's also important for the assistant to take notes throughout the conversation. That goes more sort of later on into transcription and reporting, which will be in another session. But it's also important for the assistant to help to take notes for the facilitator so that the facilitator can really be engaged in the conversation. And after the conversation, the assistant and facilitator will sort of recap with each other and note sort of general takeaways, make any additional notes that will be helpful later on for the recording and reporting of the focus group. So I have a few more slides, but I might stop there for the sake of time. I don't know if we want to leave a few moments for questions, or I can keep going.
Yes, colleagues, let's get your thoughts. If we can go for 20 more minutes, within those 20 minutes, we could cover the remaining slides and also answer a few of your questions. Let's hear your thoughts, and thank you so much for your patience.
Yes, this is Joe. I joined a little late. I think let us give some more 20 or 25 minutes so that we complete. Then next time we'll get a different thing altogether.
Okay, thank you, Joe. Victor also has the same idea. Samantha, you can proceed with the remaining slides, and then we give some few minutes for questions.
Okay, wonderful. Yes, thank you all for continuing on. Okay. Okay. So just sort of further diving into a few of these best practices for the facilitator. So before the start of the focus group, we talked about having participants sit in a circle to facilitate more natural discussion. Important to sort of begin with an icebreaker so that participants can get to know each other. And we mentioned this earlier, but ensuring all participants have provided informed consent. That's really important. And I'm thankful for that question earlier about ethical concerns and issues. So that is absolutely critical before the start of data collection. And here's sort of a basic outline for introductory remarks. So say all the participants have arrived, all informed consent has been obtained, everyone's getting settled down, ready to start the focus group. And now it's your turn as the facilitator to open the focus group and get going. So this is a general outline of what your introductory remarks might look like. So you want to start with just a general welcoming everyone, introduction, so you want to introduce yourself and any other members of the research team that are present in the room. So often there will be that assistant or that note taker. There could be someone working the recording equipment, any other members present in the room. You want to make sure everyone's introduced. And then you want to introduce the topic of the research. And here it's important to talk to participants about why they were recruited, why you're interested in hearing their perspectives specifically, and what their information will be used for. What is the goal of the data collection? What are they helping to inform? And then you want to go over some general conversation guidelines. Let participants know, remind them all that the recording is going on. So therefore, ideally, hoping for one person speaking at a time so that later on when you're listening to the audio recording, it's easier to hear. Maintaining a warm and welcoming environment, encouraging participants to listen respectfully to each other, no right or wrong answers, etc. And then you'll begin with your first question. So I'm going to run through this example very quickly. But say, for example, that we're conducting a focus group among fathers of children under 5 in Yambio, South Sudan. The goal of the research is to understand and describe fathers' involvement in child health and nutrition practices. So we want to come up with what our introductory remarks might look like, following sort of the 4 principles of our welcome, introducing the topic, conversation guidelines, and then diving into our first question. So this is an example of what our introductory remarks might sound like. I was going to have Kamish read this, but I'm not sure he's able to join us, so I'll go ahead and run through this. So for example, this could look like, good morning, everyone. Welcome to our session. Thank you for joining us. My name is Kamish Kenneth Allier. I'm a public health physician and researcher. I'm also the managing director of Juba Strategic Consulting. So here, Kamish has introduced himself, given his background, who he is. If there was an assistant there, he would also introduce the assistant. Next, to improve family-based programs for child health and nutrition outcomes, we're interested in understanding fathers' involvement in the health and nutrition of their children. That is why you all were invited to join us. As fathers of young children, we're interested in learning about your experience. So this is introducing the research topic. It's saying why they're there, what they're interested in understanding, and telling participants why they were recruited, why we were interested in their experiences. Moving to point number 3, throughout our conversation, we ask everyone to show respect, no correct, incorrect answers, audio recording. Number 3 here is really just going through sort of guidelines for the conversation, setting some general rules. And then number 4, if all of that sounds good, we will begin to get to know each other. Let's go around and introduce ourselves. So that's then opening the floor, allowing everyone to introduce themselves, and then diving into the first research question. So that's just an example of what some introductory remarks might look like, and some of those key points that are important to incorporate. Then during the focus groups, and now that it's begun, it's important to try to make sure that all participants have an opportunity to talk. You don't want it to be too rushed. If you ask a question and one participant answers, pause for a bit and allow some space for anyone else to speak up and to have a choice to speak. It's not important to rush too quickly. It's okay to repeat questions as needed. Ask additional probes. We focused on that earlier. If something unclear is said, ask for clarification. And then giving time between each question. So just general rules of thumb there. And then afterwards, towards the end, very important to thank all participants for their time and participation. Allow participants to ask any questions and follow up with them. Ensure they have contact information of who to contact if they have any questions. And then it's often helpful as well at the end to sort of draw a diagram of the room and where each participant was sitting. And this will be helpful for later on in the transcription process when you're listening back to your audio and trying to remember who was who. And sort of assigning participant numbers, but we'll get more into that at another session. Important to ensure that you stop the audio recording, that everything is saved, and then to debrief with your assistant or the note taker who's there as well, and to label all notes and audio files. So just general sort of best practices there. And just general additional notes, participants do not have to answer any questions that they do not want to. So if there's a question that's asked that you can tell no one really wants to respond to or answer, that is okay. I'm able to just move on. No one has to answer. Participants are also free to cease participation at any point. If a participant needs to leave during the conversation, that is okay. They're able to do so. And as a general rule of thumb, try to go no longer than 90 minutes. After 90 minutes, it's a lot of time to be sitting and discussing. So just being cognizant of participants' time as well. And then here are just a few best practices for the assistant or the note taker. So there'll be the main facilitator guiding the conversation, and then an assistant who is taking notes and helping out sort of in the background. So this assistant is responsible for taking notes throughout the conversation. And it's important that notes are as clear and consistent as possible. So later on, towards more of the reporting and analysis phase, other members of the research team will need to read and understand the notes. So it's important that try to maintain notes that are clearly legible, easy to understand. And often it can help to sort of have a form ready to go at the beginning of each conversation so that the note taker can, clearly and consistently record notes from each focus group. But what should they take notes on? So really open to the assistant, but some ideas of things that are helpful to have notes on for reference later on. Could be some notable quotes or phrases. If there was something really important that was said or that really stood out, to take note of that. Major points, takeaways from each question. potential additional questions that come from the discussion. So as the assistant is listening to and observing the focus group, they may be coming up with some additional topics or questions that could be interesting to explore later on, and noting those questions down. Any key ideas, thoughts, hypotheses arising, jot those down. And then also thinking about factors of the focus group. So thinking about the environment and participants. If there were any disruptions throughout the focus group, noting that, noises, what the environment was like, if there was anyone else present in the room besides the participants and research team, making note of that. Making note of any key body language, anything like that. So really anything that could be helpful later on when it comes to the reporting and analysis phase. Okay, that is all for today. I know we'll have some follow-up sessions on sort of transcription, and then I believe plans later on for analysis. But that was everything I had today. Thank you all for sticking with me through it and going over time a little bit. So I will stop there. Any questions?
Okay, thank you so much, Samantha, for this brilliant presentation. It's been a lot of learning for myself as well. Okay, going straight to our participants. There have been a number of questions posted in the chat box. As I scan through the previous one, there's this one question from Joseph, who is saying, in a place where you are conducting FGDs and the participants are more of their mother language, is the translation allowed for easy understanding from the group? Joseph, do you want to ask this question direct to make it relatively more clear?
Yeah, thank you so much. Thank you, Samantha, for the wonderful presentation. Yes, like for the context in South Sudan, because sometimes you may have gaps in the place where you want to do some research for any project, and then it happens that sometimes these areas where you're going, people may not know your language. So for the matter of understanding each other, because the research is very technical, that you need to collect good data or you need to get good information from the people. So your understanding with them is quite important. So I ask this one because I know that is it important to get somebody who can translate the language? Like maybe assuming that Samantha, if you want to go to South Sudan, you want to make the research, maybe Belgium. I assume that you don't speak no language. How will it start? That's why my question came in this way, that is it good to have a translator to coordinate? Yes, thank you.
Yes, thank you. No, fantastic question. And I'm very, very glad you brought this question up. So yes, it is very important to try and have the focus groups presented in the mother language of your participants. So often, you'll start with your focus group guide in one language, whatever the language of the research team has agreed on. But then it will need to be translated if the mother language of your participants is another language. So at that point, the questions, everything would be translated, and you would want someone who speaks that mother language to facilitate the focus groups. So whether that is someone on your research team who speaks that language, or it could be recruiting and training another researcher. But it is very important to, as much as possible, try to conduct focus groups and qualitative research in the mother language of the participants themselves. And then when it comes to analysis, there will be a translating back option. So for example, previous project I worked on with Kamish was in Somalia, and we created our focus group guides in English. We worked with our in-country partners and team. Those guides were then translated to the local language, and then our transcripts from the recordings were then translated back to English. So it is really important to have that translation and try to be in the mother language of the participants. Yes. Thank you for bringing that up. Great question.
Yes, another one. I think my colleague there is following the question from the participant who are attending the session. So my other question before was about the recording of the audio, because in most cases, like maybe you want to record, and then when you go back, you need to listen, and also get the facts about what you have actually done or what the participant might have said. I mean the the people that you are conducting the focus group with them. So in South Sudan, recording and also photographs and all this, I think is also restricted. So I was asking about the consent of the participant, because in most cases, I'm a journalist. I know how I always talk to the people, because you need to get the consent. Recording people's voice or taking people's photos without the consent. For us in the media is actually against our code of conduct. The same like somebody doing research, we need to also be mindful of that. So is it very important to get full consent of the people, because some people may not need their voices to be recorded? They will ask a lot from, where are you taking your voices? For what? If they have not understand your concept very well. So this is what I'm trying to ask about the recording
Yeah.
of the people's voice. Yeah. In the discussion.
Yes, great question. Yes, so it is very important to have that consent for any audio recording, for photos, and that is something that you would disclose at the beginning in that informed consent form when you're speaking to potential participants about what their involvement would entail, what any risks are. At that point, you would say that you are planning to audio record the conversations, that their voices and responses will be recorded. And that would be something that participants would need to provide informed consent for. And, there are cases where audio recording is not possible, and that's okay. And that's when the role of the note taker becomes really important. So if you aren't able to record in a specific environment, taking those notes throughout the focus group is really important. And then sort of having that debrief with the facilitator and note taker afterwards, summarizing, writing down key points while it's still fresh in your memory is very important. So there are some cases where audio recording is not an option. But if it is, it's receiving that informed consent ahead of time is very important. Yeah, thank you for bringing that up.
I want to also add on that. Recently, we conducted some focus group discussions in Awil, and here we were interviewing a group of uh, mothers. Now, when we sought consent to record the interview, two mothers declined for their voices to be recorded. So what we did was, whenever they are speaking, we pause the recording, and we also show to them that the recording is paused and they can speak confidently. That's one option. And then the second one, when we went to the next village, one of the participants just requested that they're not comfortable with the recording, and so they actually requested to leave the interview. And we were very happy for that, because as we always encourage, participants are not really tied in any means to the discussions. They can leave at any time they want, and no offense, no implications. Over.
Yes, absolutely. Yeah, that's a great example. Yeah.
There's there's a hand up. Yes, Chris, your hand is up. And then Xavier, I can see you also have a great question if you want to raise that through voice after Chris. Over to you, Chris. Chris, are you able to speak? Could you unmute if you're muted? Okay, Xavier, are you able to speak as Chris prepares to come on?
Okay, thank you so much. Now, my question is about especially during FGD, after introducing the topic and why we're maybe like doing that. And then some participants usually during the discussion, they usually raise some questions, eh? And most of those questions are related either to needs or something related to the topic, fine. But in most cases, they usually press for like kind of a response-based kind of like assistance. If maybe there's something that you're discussing about health, maybe they want some kind of solutions, and they want maybe the researchers to take action, or maybe they feel either government or institutions are not taking. So you find like they have that such kind of pressing things. Eh? Though you think that maybe for you researchers, and then it's going to inform the policy, it's going to like be used maybe in the future, like kind of programming. But for them, they feel like they have done it over and over again. And this is a field work where we meet different agencies, different work, doing almost similar things, and they feel like they have answered and answered and answered, and they are not getting solutions. So as researchers now, at that time, how do you handle that issue? Thank you.
Yeah, that's a wonderful question. And I think that's very context specific, where you're working in. And I think it would be helpful, as a research team to sort of come up with some ideas ahead of time how to respond to those types of questions. I think it's important to talk about what the research is being used for, what the next steps are. If you can provide any sort of guidance or strategies to do that. But I think, yeah, it's a tough question. I think it's very context specific. And I think, yeah, having some guidance from the research team on how to answer those. I think it's difficult to give sort of general guidance on how to address that. For example, I think there could be a place in the research protocol that you may be able to refer them to specific services or refer them to specific individuals afterwards and follow up with those concerns. But I think it's important to also not, make any sort of broad promises that cannot be kept or anything like that. But I think it's very context specific. So I think it would, yeah, require more discussion with the research team.
Yeah, thank you, Samantha. I think recently when we were conducting one assignment for one of our clients where we were assessing the targeting approaches, that the client use when determining food distribution in the community. One of the important questions that came, and it was clearly in that manner, that the participant asked, we've not received ratio for the last 5 months. And for those who received, they actually received half of what they used to. Now that you have come to talk to us today about the ratios that we get, are we going to expect increase in the food rations? And are we going to expect reinstatement of the food distribution in the areas where they were they were canceled? So all that, really the answer to that, definitely we don't go there to make promises, otherwise that can create trouble. So we catered for that earlier in the introductory phase, because we did outline clearly the purpose of the interview and how the discussions, the kind of benefits that the participants would get after participating. And we outlined clearly that this interview is not intended to reinstate or increase on the food rations, but it is just intended to get an overall understanding and inform policies in the future. So with that, they would get an understanding that I'm going to participate in this interview to kind of provide general context, but I'm not expecting a benefit tomorrow. So as a qualitative researcher, you should always anticipate the kind of question they're likely to ask and try as much as possible to incorporate them in your opening statement, and that must form part of your informed consent as you explaining to them, so that when they do agree, they don't over expect beyond the objectives of the study.
Mhm. Yes, yeah, thank you for providing that additional context and example. That's a great example to work through and think through. I think it is very important at that informed consent stage to talk about what are the goals of these specific conversations. And often it is to describe and inform and use that information to reach decision makers, to reach policymakers, and to give participants a voice that can be heard.
Okay, great. So the next question is from Betwell. How do you deal with questions or conversations from participants that brings conflict from
Mm.
focus group? Wow, great one. Over.
Yeah, that is a great question. So yeah, there might be instances where a question is asked and one participant says something that then causes conflict that another participant disagrees with. I think it's really important at the beginning of the conversation to sort of set those ground rules and guidelines of being respectful of each other's opinions, understanding there is no wrong or right answer, and that even if your answer differs from that of someone else, or if there's differing opinions, to respectfully listen and allow those voices to be heard. So I think setting those ground rules ahead of time is really important. And I think throughout the conversation, just encouraging respectful listening, active listening it can be helpful. There might be some conflict. And that can also, help give you an idea if a specific topic, if there are very differing different views. But I think really just trying to encourage respectful listening is most of what you can do in those types of situations. But great
Wow.
question.
Super. Thank you, Samantha. There was this question from Victor that came much earlier. How can a researcher ensure trustworthiness and accuracy of qualitative findings?
Mm-hmm. Yeah, that's a great question. And I think a lot of that will come through sort of the reporting phase as well. So that checklist that I mentioned earlier, the core checklist, has a lot of details of specifics of the research that need to be reported. And all of those are to help, improve the transparency, improve the trustworthiness of the research itself, of the data itself. And that's why that note taking is so important during the focus group, to note if there were disruptions, to note down if any participants left throughout the process, to note who else was there. Because sometimes if there are other people in the room, that may affect participants' comfortability answering specific questions. It's important to think of the environment of who's there, who's present. And reporting all of those details really helps to maintain the integrity of the research, the transparency of the data, and build trust into what is reported. And often this will come in the analysis and reporting stage as well in another session. A huge practice in qualitative research is directly reporting direct quotes. So not only talking about our takeaways from the research or what we think things mean, but directly representing the participants' voices through their direct quotes, word for word. And that'll come a lot in another section. But I think, yeah, one huge way is that note-taking stage, and following these types of guidelines through the correct checklist of what to report, and building trust through reporting and disclosing all of those additional details.
Wow, that's super. Thank you, Samantha, for those insights. Colleagues, we can give one two opportunities for you to ask questions. Anyone wants to ask a question?
Yes.
Yes, Joseph.
My question is down there. I'm sure you might have seen it. Maybe you can. I'm already feeling the question. answering the whatever you shared with us here. I was saying like in other situations, like in the country of South Sudan, due to this economic crisis, people are not the same. You go to remote areas, people look vulnerable. So whenever you want to talk to them, they might demand something. Then in the process, as a researcher, or you want to get information from these people, how can you treat them? Because the information that you really want to get from them, but they put a condition that for them to release you information or to have a focus groups discussion with them, they need some payment. How can you treat these people?
Mm. Okay, so, yeah, sorry, just to recap to ensure I'm understanding the question correctly, and my audio is a little bit thinking about if participants are asking for some type of incentive or payment for participation. Is that the question? How to handle that?
Yes, exactly, Samantha.
Okay.
So Joseph was asking the
Mhm.
question around participants who would want to be compensated for the responses that they
Yeah.
provide for a given interview. How do you handle that? Like
Mhm.
you entered into this community and you got the participants and they'll be like, okay, you either pay us or you're not getting the
Mhm.
information. And according to Joseph, you actually want the information. What do you do?
Now,
Yeah.
another explanation around this, because in other locations, I have experience whereby before you gather people in one place, you always realize that there is very high expectation, more especially areas where the people are very vulnerable and they are always expecting aids or support from NGOs. So once you
Mhm.
go on that kind of research or a kind of survey, they make sure that at least that expectation is there, that at the end of the meeting, they need to go with something in their hands, in their pocket, something like
Mhm.
that. It is very common in South Sudan. So
Mhm.
what can you do? Can these kind of things, can it not really compromise the outcome of the survey or of the research?
Yeah, that's a fantastic question. Great question to ask, and another tricky scenario to think through. I think that is very important to think about early on in the research process to discuss with the research team, whether any incentive will be provided and what that will look like. Whether that will be a small monetary incentive or whether that will be providing refreshments, snacks, things like that at the focus group. That's a common practice as well. So I think having that defined early on with the research team, what is feasible for the team, and then having that communicated to participants, early on, so that they're not agreeing to participate and then expecting they'll receive something and then they don't. So expectations should be communicated very early on. I think throughout that informed consent process, throughout talking about what participation would entail, you can talk about, there will be refreshments provided, or, there will be a small thank you for your time. So communicating that, I think early on is helpful. But it is a tricky question and one that is context dependent. So I think would just require some conversation with the research team and thinking about, I think, to previous experiences as well that other research team members have had, what has worked well, what hasn't. But participants should always agreeing to sign on to a focus group or to any research. Participants should be completely aware of what is expected of them, what they will receive in return, if they will receive anything in turn. But there shouldn't be any surprises throughout the research process for participants. So I think sort of one of the best ways is to mitigate that is through that transparency and discussion early on.
Well, thank you so much, Samantha, and Joe is very appreciative of that explanation. Okay, colleagues, thank you so much for spending your weekend with us today. Um, we will communicate the date for the part 2 of this training. Please do endeavor to register in the link that I posted on the chat box. Samantha, any closing remarks?
Yes, I just want to say thank you all so much for joining today and taking some time from your Saturday to join. It's really been a pleasure spending some time with you all. And this was just as helpful and enjoyable for me as well. So thank you all so much for your time. And yeah, wish you all the best and have a great rest of your weekend.
Thank you so much, and thank you everyone.
Thank you
for your
so
time.
much. Bye for now.
Thank
All
you.
right, great. Thank you, everyone. Bye.
Yeah.
Thank you.
Thank you. Bye.
Thank you.
Bye.
Thank you, Samantha.
Bye.